Neuroradiology is a special type of medical imaging that focuses on brain and spinal conditions using MRI, CT, and sometimes treatment in interventional radiology. We run with a multidisciplinary team made up of radiographers, radiologists, clinical scientists, radiology nurses, and also our administrative and clerical teams.
We work very closely with our colleagues, mainly neurologists and neurosurgeons. So in a way, what we do is we try to answer the questions that they have related to the patient. What does the patient have? How do you going to treat it? And so on. We look at them, at these questions, and try to find the best way of answering them. So selecting the best tool. Once that's done, then we make sure that the patients are imaged adequately, and then we do the report or we do the intervention. So that needs a very close interaction and communication with both specialties, which is what neuro is about.
We're a large department in the lower ground floor of the National Hospital of Neurology and Neurosurgery, located in Queen Square, which is in central London. Luckily, we've just been refurbished, so we have some state-of-the-art equipment that's just been put in this past year.
A typical day for me will be scanning patients depending on their clinical needs and their condition. We have to make sure that patients are safe to proceed, fully understand what they're having done and consent to having a scan, or sometimes cannula and injection of dye. Most of it is people skills really. We have a lot of patients that come sort of anxious, nervous, sometimes claustrophobic. So it's really important in order to get them to have the best experience that they possibly can, to have good people skills and make sure that we're explaining exactly what we're doing, why we're doing it, and if they have any questions, just ease their concerns.
We liaise with the clinics and we liaise with the different wards to make sure patients that need to be scanned are prioritized and brought down in a timely manner and scanned in an effective way. Most of our scans are head and spinal scans. So a typical day would be a brain scan, neuro-oncology. You have to know your patients very well and practice patient-centered care. You deal with them as an individual. It's not a one-size-fits-all.
We have the opportunity next year to have another part of the department at Grayson Road, which will have a suite of 5 scanners. One of them really dedicated to research belongs to the university, but run by the department, and the 4 others for NHS patients.
We're really excited about the new MRI scanning facility that's going to be available at Gray's Inn Road. One of the most exciting things is the cutting edge technology that we have available to us. So we have brand new 3 Tesla MRI scanners with very powerful imaging gradients.
We will have one MRI scanner dedicated to research. We will have the opportunity to exploit more innovations in technology and run more research studies in many different diseases.
Neuroradiology research is important for patients and for many reasons. Research helps us to develop new drugs, also helps us to develop new MRI methods that can eventually be used in patients to understand more about the underlying pathological processes in these neurological conditions.
NHN is a brilliant place to work at. You have a long history of excellency and expertise. We have the most modern equipment that you can get, on the one hand. On the other hand, we have a very close relationship with the university.
I'd really encourage people to come and work here at the National Hospital. It's a fantastic research hospital with a great focus on translating cutting-edge research into patient care.
We're always learning, there's always opportunities to learn. And in terms of the neuro department, we're quite a tight-knit group and we all know who are the right people to contact. Our team works very efficiently, everyone knows their role. If you have any queries, they can be answered and fixed quite quickly.
This department is like a family. Everyone is nice, the department is well led, everyone is lovely, and we have one of the newest machines in the whole country. So I would say if you are looking for training, development and career satisfaction, you should look at the National Hospital for Neurology and Neurosurgery.
So all of our neuroradiology and neuroradiography roles are advertised on NHS Jobs, Track Jobs, and on the UCLH website.